Good morning, everybody. Today, our subject of discussion is diarrheal management, especially the nutritional aspect. Diarrhea is a big concern in Africa, Asia, and Latin America. 550 to 1000 million episodes per year, 3.3 million deaths per year, 2.5 episodes per child per year. Diarrhea is one of the leading causes of infant mortality and malnutrition in the developing countries. What is diarrhea? Loose or watery stools at least 3 times in 24 hours. Consistency matters more than frequency. Frequent passing of firm stools, according to World Health Organization, is not diarrhea. Classification of diarrhea. Classification based on duration and pathophysiological classification. Under classification based on duration is acute diarrhea, which continues less than 14 days, and chronic diarrhea, which continues up to the 14 or more than 14 days. Pathophysiological classifications means osmotic diarrhea, secretory diarrhea, dearrangement of intestinal motility, inflammatory exudate. Acute diarrhea presents clinically with infectious diarrhea, vomiting and watery stools, or diarrhea with blood and mucus and abdominal cramps. Acute gastroenteritis, it is self-limited more or less within a week or so. Dehydration, the most important complication. Chronic diarrhea, impaired absorption of nutrients, malabsorption syndrome. The younger the infant, the higher the risk of chronic diarrhea following acute diarrhea. Causes of chronic diarrhea. The time limitation or the age duration is 1 to 24 months. The main causes are cow's milk protein, lactose intolerance, soya milk protein, post-infectious gastroenteritis, other food-sensitive enteropathies. Cow's milk protein and other food-sensitive enteropathies are important causes of chronic diarrhea in young infants. Chronic diarrhea, the clinical presentations is severe malnutrition, growth retardation due to repeated episodes of infectious diarrhea in a contaminated environment, immune depression in conditions such as celiac disease or Crohn's disease. Main consequences of diarrhea is water and electrolyte losses, which leads to dehydration and nutrient losses, malabsorption and malnutrition. Management of diarrhea. Oral rehydration and intravenous rehydration are the two key points. Under oral rehydration, to prevent and correct dehydration, effective, simple and inexpensive, recommended independently of etiology, nutritional status, vomiting or severity of diarrhea. Intravenous rehydration, in special cases only it is needed, specifically in case of severe vomiting, circulatory failure and central nervous system damage. Refeeding, principles of refeeding. Malnutrition is preventable by feeding during diarrhea and convalescence. Past practice was fasting the patient from 24 to 48 hours to rest the gastrointestinal tract. Present practice is early provision of nutritious food is essential. Continuous and adequate diet during diarrhea, which causes shortens duration of diarrhea, ensures full recovery, improves nutritional status after diarrhea. Feeding regimen: breast milk, lactose containing and lactose free milk, semi-elemental diets. Breast milk provides nutritional elements immunoglobulin, antibodies against enteropathies, hormones promotes gut mucosal proliferation and recovery. Lactose-free formulas. What does it? Lactase deficiency consequences of diarrhea, mucosal and villus injury. Lactose-free formulas, it means, for example, milk or soya, accelerates recovery. Common formulas used during diarrhea: milk-based formula, cereal-based formula, soya formula. Milk-based formula provides all nutritional requirement during diarrhea. Energy profiles close to mother's milk, provides all essential amino acids, provides adequate zinc and nucleotide for quick regeneration of intestinal mucosa, prevent malnutrition. Cereal-based formula, there are some advantages as well as disadvantages. Quicker resistance against water stool, added rice flour, banana powder, apple powder, which may increase osmolarity. Used only in short duration, energy profile not closer to mother's milk. Iron content lacking, no nucleotide, high price. Soya-based infant formula used in diarrhea. Safety issue and potential adverse effects are adverse effects of phytoestrogens, thyroid gland, sexual development and fertility, immune system, central nervous system's problems. Allergenicity of soya. Soya is a potent allergen. Soya is at least as allergenic as cow's milk protein. Up to 40% of infants intolerant of cow's milk also develop soya protein intolerance. Soya protein can cause intolerance reactions with gastrointestinal symptoms and acute anaphylaxis. Feeding soya formula from birth in infants at increased risk of developing allergy does not have a beneficial effect. Feeding during diarrhea. Proper feeding during diarrhea has been shown to be beneficial and prevents malnutrition. Easily digestible, energy rich, high potassium containing non-fibrous food should be given to the child. During convalescence, at least one extra feed daily for several weeks is recommended. Thank you very much to join with me in this fine morning.